I am talking today about how acupuncture can help women during pregnancy. And I'm going to list off the 10 top things that I see in my practice. These are things that I see and treat all the time, things that acupuncture can help with. And I wish more people who are pregnant knew about them because they really are amazing ways to overcome really typical and common symptoms during pregnancy. So, here are the top things that I see most often. Primarily, I see a lot of fertility patients, so I get to see them in the first few weeks of their pregnancy. And the things that I'm working on most during those first few weeks is really just stabilizing the pregnancy. And then we're looking at reducing cramping in the uterus and preventing any kind of bleeding. In acupuncture world, we look at that as miscarriage prevention. A lot of people say, well, what in the world can you do for miscarriage prevention? And the truth is that the vast majority of miscarriages are a result of some kind of chromosomal defect, in which case we simply can't do anything. If your body's going to miscarry in that situation, then acupuncture certainly can't prevent it. But there are cases where the uterus is irritated, there's excessive bleeding, even sometimes bleeding that's not really pathological but is super scary. And acupuncture has a huge role to play in those situations. We really can shore up bleeding and support the body in a way that gives it the resources to take care of excessive bleeding when it's not supposed to be happening. So, the way that we look at miscarriage prevention in acupuncture is by reducing cramping in the uterus if there's any cramping that's causing problems, by reducing or eliminating any kind of unnecessary or unwanted bleeding, and then overall providing the resources that the body needs to support a healthy pregnancy. So I think those things are super important. The next thing is maybe my most common complaint during the early stages of pregnancy is nausea. And that can be all different severities. Sometimes people have just a low level chronic nausea, and then some people have the more extreme hyperemesis version. Hyperemesis is a whole different ballgame, but a lot of women have just a chronic low level nausea. They might vomit every once in a while, but more often than not, it's just a consistent, maybe ebb and flow throughout the day, but it's kind of always there. And that doesn't feel good for anybody. And it really impedes quality of life, ability to work, ability to engage in life in general. So acupuncture is amazing at treating nausea. And in my practice, I hit it from a couple of different perspectives. First, acupuncture, always acupuncture. And then supplements. There are actually some supplements that are wildly helpful for some women. It's not across the board. You really have to try a few things out to see what best works for you given your situation. And in my mind, anyway, given your particular nutritional needs, because the supplements are based on possible nutritional deficiencies that might be exasperating nausea during those first few weeks. And then the other thing that we always talk about is just management techniques, and we're looking at things like regulating blood sugar, avoiding triggers, keeping the stomach kind of half full, those sorts of things. And when you combine acupuncture with supplements and those kind of management techniques, you really can get by so much easier. And hopefully the nausea will begin to abate around 10 or 12 weeks, in which case we just kind of ease off all of those treatments. Next thing, number 3, is supporting fatigue. Oh, pregnant women, they can be so tired during their first trimester, and especially during those first 10 weeks. And acupuncture can really help support that. And it's that same kind of idea that I talked about earlier, which is really giving the body all of the resources it needs to function easily, effectively, efficiently, and properly. So it's just allowing the body to naturally do what it needs to do instead of having any kind of stagnation or things in the way. Next up, number 4 is sinus congestion. I see this all the time. Even if it's not a full-blown cold or an infection where you might need to get treated, although sometimes in some women it progresses into those things, lots of women will have chronic just sinus congestion or stuffy noses. It can be during first trimester, but honestly, it can be during most of the pregnancy. I see a lot of women complaining about sinus congestion in their third trimesters too. So acupuncture is amazing about really opening up and clearing out the sinuses, especially during pregnancy, because sometimes it's not about mucus congestion, it's literally about swollen passageways. And you can see within 2 needles, your whole sinus open up and your nasal passage is clear. It's really wonderful. And if you never thought that you were going to ask for needles in your face, this is the time that you're going to. This is when I hear pregnant women come back to me and saying, like, "Ooh, can you do those ones in my face again?" Because they were really helpful. So uh, that's sinus congestion. And then next up is back pain. And honestly, it's different for all women. It could be really like shoulder related, it can be upper back, it can be lower back, it can be sciatic stuff. But acupuncture is amazing, especially during pregnancy, because lots of times this kind of back discomfort will come on during the actual pregnancy, which means that it's not necessarily, although it can be exacerbated by this, a long-term chronic problem. And I can't tell you the results that I see in regards to acupuncture during pregnancy for back pain. It's honestly one of the easiest things that I treat. Women come in, we give them a treatment, they see immediate results. It's really, really wonderful. And I wish that more people knew about it, because so often women are really suffering with back pain during pregnancy and they just think it's something that they have to deal with until the baby comes. And I'm not going to lie, there are some cases where that's true. But the vast majority of women can get a ton of relief from acupuncture alone in regards to their back pain. And that includes sciatic pain too. I see a ton of women with, it's not always full-blown, really severe sciatic pain, although it can be, but sometimes it's just a chronic level of sciatica that's irritating, keeps you up at night, can't get comfortable, and acupuncture can absolutely help with that as well. Number 6 is restless legs. I don't feel like this is talked about all that often. You know, when you're reading blogs and things online, you're always hearing about nausea and back pain, but you very rarely hear about restless legs. And I see a ton of women just have that uneasy feeling that your legs just need to move a little bit. And sometimes it's irritating enough that it will keep you up at night. I often see it settle in around sunset and in the evening time. And there's a ton that we can do for that. And again, usually this is a combination of acupuncture and electrolytes and other kinds of supplements that really help with restless legs and calming things down. And it can make all the difference, especially if it's impacting your ability to sleep. Number 7, again, a more common thing that people know about and complain about, but don't know that acupuncture can help, which is constipation and hemorrhoids specifically. I always talk about hemorrhoids, even in second trimester pregnancy, because I want to prevent hemorrhoids really early on. And especially I want to prevent hemorrhoids from being irritated during the birth process, because I hate to see women have really uncomfortable hemorrhoids when they're breastfeeding and sitting for long periods of time with their newborn. So I think it's an important thing to look at preventatively, but oftentimes women will start getting hemorrhoids, especially if they have any background of hemorrhoids, very early on in their pregnancy. So we want to make sure that bowels are moving really regularly and easily, and then that consistently happens through the pregnancy. So that's kind of preventative, but the fact of the matter is that acupuncture is so amazing at reducing actual already there hemorrhoids. I can't tell you the number of times that I've treated women and they try everything, they go to the docs don't have much to help with hemorrhoids, and a few treatments in and their hemorrhoids are either gone or just dramatically less bothersome. And then eventually go away, but sometimes it can take a handful of appointments. So it's really something to keep in mind for pregnant women who are suffering either with constipation or with hemorrhoids specifically. Number 8 is edema and fluid retention. Again, another thing that is very commonly talked about, but I think not many people know that acupuncture can help with. And I always look at it from an acupuncture standpoint of helping keeping your waterways open. So that and giving your body the strength to support venous pathways so that you're not accumulating a ton of fluid in your lower limbs. And even sometimes you can have that kind of fluid in your hands and your wrists, and that is what can contribute to carpal tunnel pain and hand and those kind of like tingly, nummy sensation in your hands, especially during third trimester. So we basically just want to keep the waterways open, and acupuncture is brilliant for that. Number 9 is anxiety, and I kind of couple that with the difficulty sleeping. There's so much going on and so much to prepare for, so much change coming up, especially, I don't know, there's a bunch of kind of fear-based things when it comes to birth and pregnancy, especially if you're going the traditional medicine route and or you're just reading blogs or things like What to Expect When You're Expecting, which I often don't even recommend for my patients just because I find it to be really fear-based and alarmist. So there's lots to create anxiety along the way during pregnancy, and we use acupuncture to really settle the mind, keep you grounded, and by extension that will really help improve your sleep, because so often anxiety disrupts your sleep, and everybody knows when you're pregnant you need every minute of sound sleep you can get. And then number 10 is the position of the baby. So this is important really once you get past 34 or 35 weeks, where you're really starting to prepare for labor and think about the position that the baby is in. And the biggest concern that I have in regards to position of the baby is that we want to decrease the likelihood that you'll need a C-section. And we also want to prevent, and these things are tied together, but we also want to prevent any stalling in labor, whether that's just you going into labor naturally, or if it's when you're having a medically induced procedure, like an induction. And so what we want to do is make sure that the baby is head down, obviously, but we do that through a variety of techniques, acupuncture, posture, positions, exercises. Sometimes we burn moxa, those sorts of things. But I am acutely aware of that in the last handful of weeks of pregnancy. And then I'm going to have a follow-up video about exactly what I do for malpositioned babies that, babies that we already know are either transverse or breech or just not in optimal position, and so it might be stalling the onset of labor, or leading women to get the recommendation for a cesarean section really early on. So I have a lot more to say about that particular topic, but it is something that we're always paying attention to starting around 34, 35 weeks of pregnancy, because that's when babies tend to really settle into their position. And that's it. Those are the top 10 things that I see in my personal practice in regards to pregnancy, and things that I think acupuncture is wildly helpful for. So I hope that helped and answered some of your questions. But as always, there's more information on my website, which is www.angelabellacupuncture.com. And you can always email me or call my office if you have further questions.